A 45-year-old man comes in with sudden onset headache, trouble breathing, blurry vision, and low urine output. Blood pressure is 180/90. Exam shows swelling of his extremities. UA shows proteinuria and hematuria. RNA polymerase 1 and 3 are positive. Hemoglobin is 7. White blood cells are 7K. And platelets are 50K with a creatinine of 2. What is the treatment? So A is IVIG, B is captopril, C is plasmapheresis, and D is prednisone. So I'll let you answer the question, and then I'll explain in 5 seconds. Okay, so the answer is going to be B, captopril. So for this question, we're dealing with scleroderma sclerosis, but the key point is this is actually a renal crisis of this syndrome. So you're going to have hypertension and renal insufficiency when you have SS. And so hypertension is going to lead to those symptoms, especially very malignant hypertension is going to cause those symptoms of headache and blurred vision. And then you're also going to get hematuria and proteinuria because of the damage to the kidneys. And then we also saw that there was an anemia because the hemoglobin was low, and then there were low platelets because that's where you get the thrombocytopenia. And these both are due to the microangiopathic hemolytic anemia. And so the pathogenesis of this is going to be the narrowing of the renal veins and vasospasm of these veins. And so what happens is if you have narrowing of these vessels, you're going to get decreased renal blood flow. And so once that happens, and once the kidneys are being deprived of blood, you're going to have an increase in the RAS system because the renal vessels detect that there's decreased blood flow, and then it's going to respond by thinking that your volume deplete. And so it's going to increase RAS, and it's going to lead to hypertension. And then you want to counteract that effect by giving the person an ACE inhibitor. So RAS stands for the renin-angiotensin-aldosterone system, and so ACE inhibits this system. And so you want to do that by inhibiting the conversion from angiotensin 1 to angiotensin 2. So you're blocking and knocking out this part of the RAS system. So that's going to help these patients reduce their renal failure. And so talking a little bit about the other problems or other answer choices. So we have plasmapheresis, but that's going to be used for TTP, which is thrombocytopenic thrombotic purpura. And then steroids are not indicated in this case because they can actually precipitate a renal crisis for patients with scleroderma sclerosis. And so for this one, you just need to look at the wide range of symptoms. And so notice that the kidneys involved with the low urine output. Notice that they're hinting at that with the creatinine as well. That's elevated at 2. And then finally the UA and proteinuria and hematuria. They're also giving you a clue with the labs showing that they're positive for RNA polymerase 1 and 3. And then the headache is also associated with that high blood pressure. So all these things combined with the anemia and the low platelets clue you in that it's going to be scleroderma sclerosis and specifically the renal crisis. So you're going to treat that with captopril, which is a ACE inhibitor. So I hope that helped, and thanks for watching.